Okay, so we're gonna start we're gonna do the hip girdle and the thigh and the leg, and then we'll do the hand and the foot together. So we're back to the full skeleton. We'll go and take away the ligaments. And we'll zoom in. We'll start with the ilium. So we'll zoom in here. So your pelvic bone or your hip bone is actually made of 3 fused bones. You have your ilium, you have your ischium, and you have your pubis or your pubic bone. So your ilium makes up the part of your hip bone that you can kind of feel. If you feel your hip bone, that's actually your ilium. And more specifically, it's your iliac crest. So let's go to the details. So here's your iliac crest, okay, that runs along the top of the ilium. Okay, and if you rotate around, you can see this auricular surface. I have it highlighted in blue. This is where the ilium articulates with the sacrum. So remember when we looked at the sacrum, when we looked at the auricular surface on the sacrum, this is where the sacrum and the hip bone, the ilium of the hip bone, articulate together. It forms the sacroiliac joint. Okay, and then if you rotate around, you have your posterior, just on the back, superior on the top, iliac spine. And you can abbreviate this PSIS. This is kind of a neat landmark. If you have dimples, then your dimples are actually at this posterior superior iliac spine. So if you have dimples, you can kind of feel this spine in the back. Okay, we're going to exit this landmark page. So now you can kind of see there's that auricular surface, okay, where the ilium articulates with the sacrum. Okay, and then I'm actually not gonna do the details on the pubic bone because it will just show you this, and it's kind of hard to tell how it's oriented when you just look at this little blue bone. So the pubis makes up the front inferior portion of your hip girdle. And the big part that you need to know, or one of the big landmarks you need to know about the pubic bone, is this pubic symphysis. Okay, this is a cartilaginous joint. It's made of fibrocartilage, just like the menisci of your knee and your intervertebral disc. And the neat thing about this pubic symphysis is that when women go into labor, they have a hormone released called relaxin that actually relaxes their joints. It's another reason why they say that women, when you're pregnant, you don't need to lift anything heavier than about 10 or 15 pounds because that relaxin is present at lower levels all throughout your pregnancy. And you can actually injure yourself if you pick up something too heavy because your joints are not as stable. But during labor, that relaxin hormone increases, and so this pubic symphysis joint gets kind of stretchy so that a big baby head can pass through the birth canal here. So we'll actually look at the differences between the male and female pelvis in just a moment. Okay, and then the last bone is your ischium. This kind of makes up your sit bone. You have a landmark that you'll need to know in here. It's called the Ischial Tuberosity. So it's just kind of hard to tell what everything is when you do the details on these bones. But your Ischial Tuberosity, that's actually your sit bone. So when you're sitting on your Ischial Tuberosity. When you look at a model of the pelvis, this ischial tuberosity is pretty roughened and rounded so that you have this nice rounded area that you can sit on. I think that's the acetabulum. So the acetabulum will actually get rid of the femur. Hey, the acetabulum is this socket right here it's kind of like a fossa. It's a depression in the hip bone where the head of the femur articulates with the hip bone. And you can see here that this socket is pretty deep, especially when you think about the glenoid cavity of the scapula. Okay, that socket was not very deep. And this one is really deep. It's pretty hard to dislocate your hip or your femur from that deep socket joint. Okay, so now we'll look at the differences between the male and female pelvis. Okay, so this is a female pelvis, and we will look at the differences between the male and female pelvis. The female pubic arch, which is this arch right here, is more rounded than the male pubic arch. So there's the female, there's the male. You can see the male arch is much less rounded. Okay, there's the female. The sacrum is actually wider and shorter. That way you have room for delivery of a baby. So there's the female. Okay, there's the male. It's longer and more narrow. Okay, and then the ischial spines. In females, they're shorter, and males, they're longer. So there's the male, there's the female. And then a couple of other things. If you look from the side, if you look at the sacrum and the coccyx on the female, it actually sticks out further, and the hips are rotated more anteriorly. And then when you look at the male, okay, you can see that sacrum and coccyx aren't pointed posteriorly quite as much. Okay, so there's male, there's female. This is the reason why females usually have larger backsides than males. It's just due to our bone structure. Okay, and then female hips are wider than male hips. Okay, they're much more narrow, and that's to provide room for carrying and delivering a baby. Okay, so now we will go back. We will look at the thigh and the leg. When you talk about the lower limb, the thigh is actually the upper portion of the leg. And then when you say the leg, that's actually the lower portion of the lower limb. So you have your thigh, and then you have your leg. So I refreshed, so you have to go take off the ligaments again. Okay, so the femur, this is the largest, longest bone in the body. Okay, we will do the details on this. Okay, so here you have the head of the femur, similar to the head of the humerus. It's a nice rounded kind of semicircle. This is what fits into the acetabulum. Okay, and then you have the neck of the femur. The neck of the femur, actually, when you hear somebody say that someone fell and broke a hip, it's usually the neck of the femur that snaps. And usually it isn't that somebody falls and their hip breaks. What typically happens, goodness, if I could talk, that'd be great. What typically happens is that someone with osteoporosis, which is basically where bone reabsorption outpaces bone deposit, so their bones become fragile and look really sponge-like, very prone to break, but it affects the neck of the femur, one of the places that really starts to break down. And so what happens is that somebody will miss a step and step too hard, or they'll step off of a curb too hard. It'll put too much weight and pressure on the neck of the femur right here, and this will snap, and then they fall. Okay, sorry, I kind of went on a tangent there. So we will go down, we will look at, remember when I said condyles and when we talked about the humerus, okay, Where epi means above, so we have the lateral and medial epicondyle. Okay, so here is the lateral epicondyle, lateral because it's on the outside, and then you turn around, you have the medial epicondyle, okay, that's on the inside. And then you have your lateral condyle and your medial condyle, okay. When you look at the femur, it's pretty easy to tell which side is anterior, which side is posterior. The posterior side has this really nice fossa, and it has these rounded condyles. This is where the femur articulates with the tibia, okay, and you can see it's nice and rounded so that that tibia can articulate and kind of hinge along these two condyles. Okay, so here's your intercondylar fossa on the back side, on the posterior side of that femur. Okay, and we'll turn it around, and here in the orange is the patellar surface. This is where the patella, actually the base of the patella, articulates with the femur. Okay, so now we will move down to the tibia. The tibia is the largest bone in the lower leg, or in the leg. So you have your tibia and your fibula. You need to be able to differentiate between these two. An easy way to, kind of a silly way to do it, is if you think of what a fib is. A fib is a little eye, so the fibula is the little bone in the leg. Okay, so the tibia, we'll go look at the details here. Okay, once again, you have some condyles, lateral, medial. Okay, and then here you have this thing called the tibial plateau. If you know what a plateau is in geography, okay, it's a flat raised area, and so the plateau is this flattened part on top of the tibia. This is where the femur articulates with the condyles here, and then you have this whole flat plateau on the top. Right, here you have your tibial tuberosity. This is important. This is where the patellar ligament attaches. If you've ever gone to the doctor and they've done the knee-jerk reflex, where they've taken that little hammer and they've tapped at the bottom of your knee, okay, they're actually tapping that patellar ligament. Oh, the malleolus. So here, this is the medial malleolus, okay? Medial, it's on the inside. This actually forms your inner ankle bone, okay? So if you look down at your ankle, the inside of your ankle, that's actually termed your medial malleolus. Alright, so let's go back, and we'll look at the fibula really quickly. Okay, so the fibula, to be able to differentiate a right from a left, anterior from posterior, the easiest way is to look at the malleolus, okay? You have a lateral malleolus here, okay? This actually forms your outer ankle bone, okay? It's this whole portion on the bottom. Okay, if you look at the malleolus, and on the models, this will be much easier to see. It kind of points anteriorly, so it points to the front, okay? And it also, the fibula kind of curves laterally. So the fibula, you just need to know the head of the fibula and the lateral malleolus. I might have a model out and say, is this a left fibula or a right fibula? So you'll kind of need to be able to tell your right from your left. Okay, and then the last thing here is the patella. Okay, your patella is just your knee bone. Okay, you have your apex down at the bottom, and then you have your posterior facets at the back for the condyles of your femur and your tibia.